close to 20. Okay. Good evening, everyone.
Good evening, sir.
Okay. So on behalf of AfriScience network team, we invite every one of us to the third in the series of our monthly webinar of AfriScience. So before I invite the person to read the citation of the speaker, I'd like to briefly introduce the chairman for this webinar. The chairman is Professor Adefolarin Omalomo. He's a priest and a neurosurgeon. He holds a joint appointment with the Department of Surgery, which is primary assignment, and the Department of Human Anatomy at the College of Medicine, University of Ibadan. Professor Malomo is a member of National Bioethics, and he teaches bioethics at the postgraduate level. He is a fellow of the West African College of Surgeons, International College of Surgeons, also a fellow of the National Academy of Medicine. He was the former Dean of Clinicals at the College of Medicine, University of Ibadan, and the former Chairman, Medical Advisory Committee of the University College Hospital Ibadan. He was also the former NVMA Chairman of Oyo State. Professor Malomo is happily married with children and grandchildren. So I invite Dr. Abu Malik. Dr. Abdul Malik is a lecturer at the College of Medicine, University of Ibadan, and is a consultant at UCH Ibadan. Dr. Malik, you are welcome to read the citation of Professor Babatunde Salako, our presenter. Thank you very much.
Very much, Professor Shoiton, and good evening, distinguished ladies and gentlemen. It's a privilege to read the citation of my teacher and mentor, Professor Babatunde Lawal Salako. Please, can you see my slides?
Yes, we can.
Okay, thank you. Professor Babatunde Salako is a seasoned physician, a teacher, a researcher, and administrator. He is currently the Director General of the Nigerian Institute of Medical Research, Yaba, Lagos. His primary employment remains as a professor of nephrology at the College of Medicine, the University of Ibadan, and an honorary consultant physician and nephrologist at the University College Hospital, Ibadan, Nigeria. Professor B.L. Salako's foray into medicine began in 1986 when he obtained a bachelor's degree in medicine and surgery, MBBS, from the University of Ibadan, and further went on to become a fellow of the West African College of Physicians in 1994. He became the head of Department of Medicine in both institutions in 2011 and was the provost of the College of Medicine at the University of Ibadan between 2014 and 2016, when he was appointed as the Director General of the Nigerian Institute of Medical Research, NIMA, in Yaba, Lagos, by President Muhammadu Buhari. By dint of hard work and good clinical practice, Professor B.L. Salako was elected Fellow of the Royal College of Physicians of Edinburgh in 2014 and the Royal College of Physicians of London in 2016. Professor Salako was the chairman of the Nigerian Medical Association, NMA, in Oyo State from 2002 to 2004, and assistant editor-in-chief of the African Journal of Medicine and Medical Sciences from 2012 to 2014. He was appointed the editor of the Tropical Journal of Nephrology, the official journal of the Nigerian Association of Nephrology, between 2005 and 2012, having become a member since 1991. He has been vice president of the association in 2012, president-elect of the association in 2014, and later president of the Nigerian Association of Nephrology in 2016. As a nephrologist, he displayed excellence in the performance of his duties. He was recognized by the board and management of the University College Hospital Ibadan in Nigeria in 2008 with an award of excellence and commitment to medical practice in recognition of his contribution to the first successful kidney transplantation at the University College Hospital Ibadan. He was subsequently invited by Novartis International Pharmaceuticals as an opinion leader in an expert panel to discuss kidney transplantation in sub-Saharan Africa in Dakar, Senegal of 2010. He has thereafter been invited as a guest lecturer or keynote speaker over 100 times. Over the years, Professor Salako has worked on hypertension and kidney diseases with grant support from the College of Medicine and Senate of the University of Ibadan, the MacArthur Foundation, and 5 NIH grants. Anyone who is in research and has ever attempted getting funding will know what it means to have won 5 NIH grants as both site PI and in a project with multiple PI on the H3 Africa Kidney Disease Research Network Consortium in collaboration with the Department of Public Health Sciences of the Loyola University, Chicago, University of Michigan, USA, and the University of Arizona, as well as University of Ghana. He was a visiting professor at the University of Arizona, University of Michigan, Loyola University, all in the US, and visiting nephrologist at Manchester University Teaching Hospital at different times. He has been an external examiner/reviewer to a number of universities, both at home and abroad, including the University of Cape Coast, the University of Cape Town, the University of Western Cape, the South African Research Foundation, and the Wellcome Trust in the United Kingdom. He worked in conjunction with Nimet Pharmaceuticals International to formulate the drug Mini Plus when Minizide was scarce in the Nigerian market. He's a member of many international consortia, including the H3 Africa Kidney Disease Network and the recently launched Lancet Nigeria report on the Nigerian health system, on the General Assembly of the European and Developing Country Clinical Trial Partnership, and also a member of the WHO TDR Joint Coordinating Board and TDR Standing Committee. He chaired the Disease Endemic Country Committee of the WHO TDR Joint Coordinating Board for 2 years. He has been appointed as and still serves as temporary advisor to the WHO on a number of occasions. Professor Salako was appointed Foundation Fellow of the Nigerian Academy of Medicine in 2019, Fellow of the Nigerian Academy of Science, FAS, in February 2020, and Fellow of the Nigerian Association of Nephrology in February 2022. He is the Chairman, National Health Research Committee and Chairman, National COVID-19 Research Coalition. He's a member of the TEDFund Research and Development Standing Committee and the Board of Experts of the CBN Health Sector Research and Development Innovation Scheme. He has, to his credit, ladies and gentlemen, more than 200 journal articles in both local and international journals, including 2 books, one on nephrology for laypersons and the other his autobiography. He's happily married to Mrs. Saidat Abiola Abiodun Salako, and they are blessed with 3 children. Ladies and gentlemen, I present to you a distinguished academician, accomplished and world-class researcher, a seasoned administrator, a medical elder and teacher of teachers, a gentleman par excellence, a mentor and father to many, including myself, my teacher and our guest lecturer for today, Professor Babatunde Lawal Salako, the Director General of the Nigerian Institute for Medical Research. Thank you very much.
Thank you very much, Dr. Abdul Malik. So, Prof, you are welcome to give your presentation.
Okay, thank you very much. I hope people can hear me clearly.
Yes, we can, sir.
Okay, thank you. I have not seen Professor Malomo, but I assume that he's on the call. I want to appreciate him for accepting to chair this call. I will attempt to share my screen now. Is this happening? Can you see my screen?
Yes, sir. Yes, Prof.
Okay, thank you. I also would like to thank Dr. Abdul Malik for that beautiful citation about me. I'd like to begin the lecture by saying that research institutes, and that includes institutions, I would say, and that includes universities and other private sector NGOs that carry out research in Nigeria or elsewhere in Africa, must be put in proper perspectives to be able to tackle health problems in Africa. Otherwise, they will not have the capacity to do so So I'm going to begin my lecture by showing you this outline. I'm going to talk to you a bit about African health profile, because that will define the kind of problems the research institutions should be solving. And why do we need health research? A little bit about gaps in health research capacity and funding, issues in relation to health research workforce and productivity, challenges to health research innovation, and then, of course, come down on the role of medical research institutions in tackling these problems. And I will end by giving you a small example of what my institution has done to tackle health research problems in Nigeria, of Africa, as you wish. Now, if you take a look at these slides, Africa has been seen as a continent of disease and conflict. We do have about 1.4 billion people living in the region, and we're about 16.7% of the world population. We have about 24% of the world disease burden. So that tells us that we need to do a lot as researchers. Unfortunately, we produce only about 2% of the world research. Again, you look at epidemics and wars. Africa has had a fair share of wars. Nigeria, as an example, is going through banditry, all sorts of lawlessness in certain areas that have affected people's health and their general life. And in spite of that, we are still battling with infectious diseases. We just went through the scourge of COVID, and Africa is just gradually getting out of that. Then the issue of non-communicable diseases, cardiovascular diseases, bringing to the fore the so-called double burden of disease for Africa. And as if that's not enough, we are beginning to see climate change issues. So Africa has quite a number on its plate that we need to look at as research institutions. It's also been projected that by 2030, death by millions will increase for cardiovascular disease, for cancer, for respiratory diseases, and for diabetes mellitus. And if you take a look at our health indices, which appears to be the poorest among the 6 continents of the world, the WHO regions, take a look at under 5 mortality. Africa seems to be, has the largest number compared to all the other regions. And if you come down to look at African countries generally, this is where Nigeria is at the top in terms of under 5 mortality. Okay? Now, if you look at maternal mortality, the trend is that maternal mortalities from 1990 appears to be coming down. But again, in Africa, we still have the largest in terms of number. Although this effect was probably due to the last Millennium Development Goal. Now we are talking about SDG. Hopefully by the end of SDG, maybe we would have made some other improvements. So you see now that we have a lot that research must have or find solution to. Research itself is seen as a collection, a coalition, or in fact, analysis and interpretation of data to answer specific questions or solve identified problems. We have plenty of these problems that I've just enumerated. But research in itself is an essential tool for improving human development or issues of health and health equity. And if we do research very well, it can deliver widespread population changes that may contribute to sustainable development of a nation. Indeed, research is meant to improve health outcomes. And if we are able to perform research that will do this, we will probably be having significant effect in improving our health system and Africa's health research indices. But how do we do that? If you look at the situation in Africa generally, you see a lot of gaps in capacity for us to be able to solve our own problem. Investigators from high-income countries seems to be the one determining funding. And therefore, we don't have an alternative but to listen to the dictates of their own research agenda. And oftentimes, this agenda may not align with our own local national needs. The challenge is that the conclusion from such research does not have any direct benefit to us. We must necessarily look inwards. We must be able to ask the right research questions as Africans. We must move away from descriptive research, but rather look at interventional research that can change policy or move things from bench to bedside. We must acquire new skill sets, especially in the area of IT, statistics, or bioinformatics. Now we talk about big data, especially in the era of genomics, precision medicine, and co. So we needed to ensure that these skill sets are developed in African researchers for us to be able to do our own thing. Ethics is another, but I believe we have developed a lot of our capacity in ethics of human research participants. But we need to do a lot more when it comes to animal welfare. Biomedical research often use animals, and we don't seem to have developed animal research ethics committee very well. So this is one area we need to do that. And finally, on this area is the issue of ability and capacity to win direct research funding. And that is because we need to build capacity in the area of grant writing, manuscript writing, mentorship, to be able to attract direct grant, since we don't have our own funding at home. This graph shows health expenditure per capita and in relation to life expectancy from OECD countries. And you can see here, health expenditure per capita, and compared to life expectancy, averagely, the higher you spend per capita, the higher the life expectancy. And in Africa, we don't seem to be spending enough. If you take a look at these two graphs, this is showing health research and development expenditure as proportion of general government health spending for 4 leading African countries: South Africa, Kenya, Uganda, and Nigeria. And you can see that Kenya and South Africa seem to be doing a bit well, but take a look at Uganda and Nigeria. The amount we are spending is rather insignificant. The same thing when you look at health research and development as a proportion of national GDP. It's the same. And we need to do more for us to be able to have effect. In fact, this one shows that most African countries live on foreign funding. We need to be able to convince our government to spend money for health research and a health system. If you look at academic publication and citation, it's been shown that government spending and publication or citation goes hand in hand. If government spend well, there will be more publication. If government spend well on health research, there will be more citation. So when we say that Africa has contributed only about 2% to the world's research, you can see that it is a direct effect of lack of funding of health research and health system in Africa. To look at African health workforce, this is the number of researchers per million population. The picture on the left side shows the map of the world. And you see the darker the area is, the more researchers per million population. Look at the color in Africa, almost empty. Now, if you come to Africa with a cone view on African countries, if you look at the absolute number, you see South Africa, you see Nigeria, you see Ghana, you see Senegal, in terms of absolute number. Nigeria seems to be doing well with other countries. South Africa seems to be doing well. When you look at researcher per million population, you see that these numbers here have reduced. In fact, for Nigeria, some other smaller African countries are doing better. Again, research productivity in Africa, South Africa and Nigeria seems to be leading when it comes to the number of publications, absolute number. But if you look at publication per million population, it's also very not significant. And this slide shows a world report of an interactive map for 9 international research funding agencies in sub-Saharan Africa. You can see that this West African region is not as well populated as East and Southern Africa. You can actually interact with this map to find out who has been funded and where the funding is. Now, when we analyze for NIH, about 145 awards in 2017, again, South Africa seems to be the only one that is doing very well, and followed by Uganda, Nigeria, and Ghana, and Kenya. In terms of absolute amount of dollar, in terms of millions of dollars, it's the same countries. But even these that we see here, when we look at collaborative effort and direct research, you see that what we have been able to do as Africans is more of collaborative research grants and little of direct research grant. So we need to change the narrative to be able to bring more direct funding that will assess and take care of our own peculiar research priorities. So I'm going to end that part of the presentation, showing gaps and all of that, using this editorial comment made by Justin Davis in the Lancet Global of 2016, titled Research Capacity in Africa, Will the Sun Rise Again? He noted that we know that there is little research capacity within Africa, that there is a shortage of faculty and research leaders, inadequate facilities and infrastructure, and few career opportunities for budding researchers. Fortunately, there is now widespread acknowledgement that African researchers are best placed to ask questions that are relevant to African issues. And of course, that there is now slow move away from parachuting research agenda or question to Africa. But how do we begin to ask our own question without the capacity being built? How can this be done? So we look at research and innovation and look at the capacity that we have. Sometimes our government just make pronouncements that they cannot act on. African leaders and African unions, they've made quite a number of pronouncements about the amount of money that should be spent on research, on health, but none of them has actually walked the talk. Again, most of the initiatives that is trying to solve research problem in Africa or health problem in Africa are from the north, not coming from the south. There's very poor private sector participation, either in terms of research, sponsorship, or participation in research. We have very weak South-South collaboration, whereas collaborating with ourselves because of our similar challenges and health problems is more likely to give us solutions. Because once we find one, it can easily be adapted to other countries. Of course, poor funding is relevant in the house. Not many African countries have had adequate funding for health, not of health research. Poor infrastructure in terms of laboratory and then in clinical trial. In the last COVID scourge, none of the clinical trial on vaccines or newer drugs was done in Nigeria, maybe in South Africa and a few other countries. We have low capacity for grantmanship, either in terms of quality or quantity, and then, of course, collaboration. And looking at global research funding, Africa has 90% of the preventable deaths worldwide, and yet what we get is 10% of global research funding to prosecute research agenda. And this is because the funding is not coming from us, because he who pays the piper dictates the tune. And looking at the last 2 decades, the number of new drugs, over 1,500, only about 2% of that actually was used or produced for tropical diseases. Again, we are not putting the money there, so we are likely going to be able to solve our own problem without putting the money. This is called 10/90 gap, and there is an association, Global Forum for Health Research, that is trying to reverse this. And I say that the only people or group that can reverse it is the African Union government. When they put money there, then we will be able to do what we are supposed to do. Taking a look at the individual researcher in Africa has poor capacity, lack of mentor, poor motivation, and then, of course, in the last 1 year, Nigeria has started talking about brain drain, the so-called Japa syndrome. So what should the medical institute be doing to solve some of these problems? The first one is training. In the area of manuscript writing, capacity strengthening for grantmanship, collaboration, networking with each other. We must also pay attention to training in new technologies, because technologies are now being used in conducting research or even in the health system. So we need to acquire new skills. We must revisit our curriculum at all levels. Perhaps we should introduce our students to health research early enough to get them interested in the subject of research by the time they become workers of their own. I mentioned North-South collaboration. Yes, we cannot throw it away. They have more experience, they have more gadgets, more money. So we just have to continue to collaborate with them to learn. But we must improve our South-South collaboration because of our shared experience and the capacity to be able to train ourselves and learn the skills. And sometimes when you go to the northern countries, you may not even have access to some of these things because of who you are. But with the South-South collaboration, that is certainly not there. We must encourage interfaculty and interinstitutional collaboration. The days of working in silos is gone since yesterday. And people who want to make impact in research must collaborate for you to be able to learn from others, take advantage of the network of others, and then be able to do big research grants. Data recently has been described as the oil of the future. So data is becoming very important in research, in issues of data sharing or secondary data analysis. Manufacturing companies, pharmaceutical manufacturing companies these days are usually interested in data and sample because of their activities in the area of drug development. And so we must be able to take care of big data, especially in this area, in the era of genomics. We need to be able to improve our private sector participation and partnership. African research institutes must partner with private sector and also the African CDC, which is perhaps now an organ that has been established by African Union and African leaders, and it will be a sure way of getting to discuss with these leaders about what we want in Africa. Above all, we must pay advocacy visits to decision makers. The decision makers are the heads of government. And this head of government in 2015 came up with what they call Agenda 2063, which I'm going to be referring to very soon. For us, we must ensure that we relate with policymakers whilst we are conducting research. Research institutions must ensure that policymakers are carried along while research has been conducted. You must communicate to them. You must inform and include communities too. Because sometimes when you find the result of your research, it's the community that you are going to use it on. And so if they are not part of it from the outset, translation may be a bit of a challenge. Decision makers are very important in the transfer of research-generated information to policy. So engaging the decision makers in identifying and defining the research problem will greatly increase the translation of research studies. In 2015, the African leaders came together, having seen that there is a lot of deficiency in the health of Africans, with what they call the Africa we want, and created 7 agendas. And number 11 of, aspiration 7 reads, by 2063, African countries will be among the best performers in global quality of life measures. This will be attained through strategies of inclusive growth, job creation, increasing agricultural production, investment in science and technology, research and innovation, gender equity, youth empowerment, and the provision of basic service, including health, nutrition, education, shelter, water, and sanitation. Now, this is an agenda set by African leaders, and we can, through advocacy, through African CDC, ensure that we get them to walk talk. Again, in the area of funding, role of Medical Research Institute, we know that we are not very well funded, but for whatever it takes, we should provide grants for intramural research, for researchers in the institutions to be able to at least come up with preliminary data that they may use to attempt to win bigger grants. So every research institution must do that. But this must not just be done for nothing. It has to be targeted at research focus, it has to be focused on national research priorities and agenda. I'm sure that many researchers have not even seen the national research priorities and agendas of their country, even for Nigeria. The last one that we tried to put together is yet to be published. But the one that expired was not well disseminated. So research institutes and institutions and researchers themselves must look for the national research priorities and agenda, because this is what speaks to the peculiar health problems that the nation has, so that when we design research, it will be to solve the identified problem in our priorities and agenda. We must also try to monitor and measure research impact, because that's how we know if the research that we've been conducting is solving problem or is just on the shelf. And that will lead me to say that implementation science research is something we must also engage in. There are many new discoveries in terms of drugs and ways of treatment or prevention of a common ailment all over the world, but only a little of them have seen and entered use among many of the national health systems. Implementation science research would help us to determine why this is so that they can be uptaken into the system. Research institutions must also attempt to advertise funding opportunities for researchers, either local funding or international funding. And many of the funders that have soft spots for Africans are what you have here. And you can easily follow them up on their websites and then apply for grants. again, with the focus on national research priority and agenda. We must continue to ensure mentorship and support program for young researchers. We can, in fact, create a sister research institution mentorship, either local or international, such that a better and well-experienced institution can mentor an upcoming institution. It is a way of supporting future research leaders to improve translational medicine in Africa. We therefore need the help, need support, we need advice, we need guidance from such arrangements. And if we are able to do that, certainly we will be able to improve our capacity to be able to contribute to solving solution, a health solution, a health problem in Africa. African researchers and research institutions must necessarily pay attention to One Health. This is an integrative effort of multiple disciplines working locally, nationally, and globally for people, good optimal health for people, for animals, and the environment. Most of the disease epidemic and pandemic that we see these days arise from animal origin. And so we should have an holistic view when we are designing our research to be able to find complete solutions to many of these pandemic and epidemic. And of course, we must not leave behind planetary health, which is the health of human civilization and the state of the natural system. Today, we talk about depletion of ozone layer, the effect of greenhouse gases, and of course, those of us currently on Earth should ensure that we leave the Earth in a better position for those who are coming behind. And the issue of climate change centers on the health of the planetary health system. These are some of the areas we must necessarily pay attention to if we are going to solve African health problem. And again, lastly, we must measure research impact to be able to assess how much we have contributed to science and to solving problems either in our nations or generally in Africa. I'm now going to tell you a little bit about what my institution did as part of contribution to solving health problems. During the COVID waves, when it started, we created what we call NIMA drive-through. But we discovered that only elites who have cars were the only one coming to do free testing. So we introduced a walkthrough. And people coming here to do tests. And you can see this is BBC that visited that center during the COVID era. But we did not just provide service. We used that place as a field for mining data from those who come to do the test. And you can see the three waves that we experienced in Nigeria, depicted by the results of tests that we did during that time. And it was easy for us to be able to predict the next wave so that we can provide information to the nation and the leading public health institution in Nigeria. Now, this tweet, for example, which I made in November 13, 2020, says there has been recent increase in the number of positive cases of COVID-19 disease at our testing center and laboratory. Nigerians need to prepare for a second wave. Religious centers should dedicate the last part of their sermons to COVID-19 prevention and the use of NPI. It is real. Now, if you look at, that is November 13. If you look at November here, you see how gradually the positive cases started. And it was easy for us to predict that we're going to have another wave. So it is the same for this last wave. And that was what then led to NIMA, the NCDC, and the University College London to carry out a sero-epidemiological survey of COVID-19 in 4 states of the Federation: Enugu, Gombe, Lagos, and Nasarawa. At that time, NCDC was announcing cases that was not up to 100,000. Yet, in Lagos, 22.9% of inhabitants have come in contact with COVID-19 virus. 23% in Gombe, 8-point-something%, sorry, in Enugu, 23% in Enugu, 8-point-something in Gombe, and 8-point-something again in Nasarawa. Now, this provided information to us that we already have community spread. Though people may be developing natural immunity to the disease, but it also tells us that we might have upsurge in cases. And so government of Lagos State, with that kind of information, can then prepare for more isolation center or prepare for more testing centers so that we are able to test people. We were also lucky to be part of managing the first case, the index case, as we were the first to sequence that case. Now, this is a phylogenetic tree. Those who understand this, we know what I'm talking about. And tracing that showed that, in fact, in about 2016, there was a coronavirus infection seen in a camel somewhere in Zaria. And the index case that we saw had 99-point-something% similar to the Wuhan virus that started the disease in the first place. Now, the advantage of that is that we later were able to determine through sequencing circulating variants in Nigeria. And we use that circulating variants using the viral structure to prepare our experiment in vaccine development, even though we've never had that experience before. But we believe that we should not wait for that to be trusted on our lab. We must do something. So we started to design using the viral architecture of the sequences that we have done to create a protein subunit vaccine with our little experience. We got to animal stage. Unfortunately, when we assess the immunogenicity from the animal, it was nothing really to write home about. We were not deterred. We went back to the lab because what we really wanted was to learn the rope and learn the experience of the processes of vaccine development. So this was just a picture when the animals were being inoculated with our developed molecule at the time. We also use the same sequencing reports and results, and of course, added to all the ones that are being reported in other parts of the world to develop a SARS-CoV-2 detection kit called SCODA. There are 2 of them. And that knowledge, again, has taken us to developing kits for yellow fever, kits for Lassa fever, and diagnostic kits for monkeypox. And I can tell you that all of these have been validated by other laboratories. The yellow fever and the Lassa fever are currently being optimized with the Lassa fever is the most difficult because the way the virus behaves, and we have about 85% sensitivity and 100% specificity for now. The kits for COVID was 100%, 90-something% sensitive and 100% specific. The same thing with the monkeypox. I can tell you that the kits that we are using in our center to test is the one that we developed. And NIMA has a policy of using whatever scientific innovation that we have made in our own environment. We also, during the time when NCDC talked about lack of RNA extraction kits, our researchers also went to develop an RNA extraction kit. Haven't developed a DNA extraction kit before. Again, these are extraction kits that we use, and they have been compared with all the foreign ones that we used to use in our lab before. We have developed a digital health solution to people who are on direct observed therapy, TB, who may not want to come to the center, and yet we can monitor them using this app, digital health solution that we developed. We have since also developed a hemoglobin machine to determine that. Again, that in fact has been published and has been tested. During the COVID pandemic, we worked with the Nigerian, Aliko Dangote Foundation, and of course the CDC Foundation, and our partners in the US, the University of New York, and many others, to adapt this oxygen helmet and CPAP for treatment of people with COVID-19 who required oxygen, because at the time there was not enough, So these are part of ways to find solutions for to health problems in Africa if we know exactly what the challenges are and our research projects are directed at solving those challenges. In fact, this was described as a game changer at the time because a lot of people could not be put on respirator. And this became something that made a lot of people survive. We trained people from at least 8 teaching hospitals all over the country, and many of the people were using this as a donation from our US partner. Of course, while working with the Federal Ministry of Health, doing entomologic survey, people here who are chasing mosquitoes around to determine molecular changes and genetic changes in the mosquitoes, finally stumble on a new malaria vector in Nigeria, Anopheles cephensis, in Bilri in Gombe State. And since then, we have started looking at the implications of this vector, which is a very, very rugged one, transmitting urban malaria on malaria control in Nigeria. And we are currently trying to map the country for the presence of this through physical mapping, and then of course, using data manipulation to be able to determine the likely area where we can see this. This is a reportable vector, and we have duly reported this to the WHO. So, distinguished listener, I'm going to end by saying that as Africa continues to struggle with reducing the burden of diseases and conflicts, medical research institutes in Africa must continue to build and strengthen existing research and infrastructure capacity through training to address the shortage of faculty and research leaders and ensure career opportunities for budding researchers in order to tackle health problems in Africa. African researchers will therefore be best placed to ask questions that are relevant to African health issues through translational and implementation research. Research institutions in Africa needs to move research in the direction of problem solving through national research policies and priorities, including One Health and planetary health. Africa needs regionally based initiative funding by African Union and the different country governments. Researchers need to carry out advocacy visits to decision makers for improved funding, reduce brain drain, and ensure uptake of medical research reports for policy and practice. There are mentors and leaders of thought in African research institutions who are capable of changing the narrative, many of who are listening to me as I speak. We must seize the opportunity of the moment. There is plenty of work to be done by all of us to carry out research that will solve health problems in Africa. I thank you all for this opportunity, and I thank you for this. Over.
Okay. Thank you very much, Professor Babatunde Salako, for your wonderful presentation. So I believe every one of us will enjoy the lecture. Before I hand over to the chairman, Professor Malomo, to coordinate the question, answers, and comments, please permit me to specially recognize the presence of one of the fathers of medicine in Nigeria, Emeritus Professor Oluwole Akonde. Is the first Provost College of Medicine and the first Chief Medical Director, University College Hospital, Ibadan. You are welcome, sir. So over to you, Professor Malomo.
Yes,
questions, answers, and comments. Thank you.
Yes, thank you very much, and also for recognizing Professor Akonde, which I was intending to do. As expected, Professor Salako is someone who has been privileged to go through some of the best places and paths in our nation and beyond it. And he has been asked to speak on something about which he has genuine experience, not only when he became the Director General at Yaba, but based on his activities and collaborative efforts much before that. He has, with data, convinced us about the necessity for us to, on our own, ask appropriate questions, develop capacities, network, and he has, I think, justified to a large extent his assertion or suggestion that we're not doing as well as we should. He did this with data, and yet suggested that there's a lot that we can do, even in our current situations, even with the present funding things. And his illustration of work at NIMR is not surprising at all for anyone who has worked closely with Professor Salako, as I did, as Dean of Clinicals, when he was the Provost of the College of Medicine at Ibadan. Now, ladies and gentlemen, this is an audience that is concerned about science and about research, of course, in more ways than medicine. But this evening, we're looking at not only medicine, but the roles that our research institutes can play. And I think by extension, tertiary health centers and various research groups with local and international grants. Floor is open now, and I will suggest, if it's all right with us all, that if you want to make a comment or you want to ask a question, please signify by raising your hand through the reaction section. Most of the chat that we have are requests and comments, but now we want comments on the presentation, which has been so excellent, absolutely excellent. The amount of requests for the presentation, which, by the way, the organizers usually do, even without requests, shows how important listeners have deemed this particular segment. Congratulations again, sir, Professor Babatunde Salako, as usual, for a great job. Well done.
Thank you very much, sir.
Thanks, sir. If any of the listeners would want to make a comment, ask a question, contribute further, you're requested to please signify by raising up your hand so that we can ask you to do so. Professor Salako very certainly will be happy to provide the best solution that he can proffer to such questions if they are directed at him. Thank you. Do we have?
There are hands up, many hands.
Oh, many hands? Beg your pardon. I'm checking the. Okay, you're still sharing your section. Okay.
Well, I can see the people who have their hands on. Many of them, I think Professor Akonde's hand is up. Professor, I appreciate your attending this lecture as usual. I'm sure you are doing very well. You may wish to make your comments, Professor Akonde. You need to unmute yourself, sir.
Well, thank you very much indeed. I just want to thank Professor Salako for this excellent presentation. Excellent in all respects, fully informative, and packed with action-oriented recommendations. The question now is, how do we move forward? I'm really delighted to have been invited to participate in this lecture and to hear your very brilliant presentation. But the thing to do now is, how do we move things forward? How do we ensure that those action-oriented recommendations of yours are implemented? Thank you very much. Well done.
Thank you very much, sir. Professor Labokukola.
Very good evening, Professor Salako, my very dear brother, and the compere for this event. I am also very delighted to hear the voice of Professor Akonde. Your presentation, Professor Salako, is nothing unusual. We're used to your excellent presentation. And I was particularly impressed by your emphasis on transdisciplinary research beyond medicine. This presentation is on medicine, but I'm happy you touched on other areas, which is lacking in many of our activities in our universities and our research centers. We cannot have good medicine if we don't talk about sociology, we don't talk about culture, we don't talk about environment. So I'm happy that you latched on that, particularly your emphasis on planetary health. There is no way we can talk about good health without talking about climate change, without talking about the SDGs. Again, like Prof said, how do we move forward here to ensure that there is collaboration, transdisciplinary collaboration, transnational collaboration, to ensure that Africa is able to resolve so many of our developmental problems. Again, thank you for a wonderful presentation.
Thank you very much, sir.
Thank you, sir.
Professor Babatunde.
Thank you very much, sir. I'd like to appreciate you very sincerely for a very wonderful presentation. I also listened to your presentation on Monday at the West African College, and I tried to ask a question. Maybe it's time for me to just ask that question because I wasn't able to ask that question. And then I'll go to the questions I have here, sir. And the question was about the regulatory and monitoring effect of NAFDAC on research activities in Nigeria. Well, I mean, I haven't had a little bit of experience with them. I think it's a bit diversionary because it doesn't appear that they are very sound and capable in monitoring clinical research, especially when it's not involving drugs. I really don't know what can be done about that. Thank you. The question I have here, sir, is that it appears that National Institute of Medical Research is a bit tilted towards infectious diseases and genomics. I want to find out because of the trend of cardiovascular disease and non-communicable disease generally now, whether there is a tendency towards that in the nearest future. And thirdly, sir, it appears, just like you said, from the slide that you showed, it's pitiable the kind of funding that Nigerian government is giving towards research. If NIH is sponsoring research in Africa, I mean, it still boils down to the fact that we're still, servitude, and we can't develop that way, just like you said. And I'm wondering whether there will be a way to get this government to possibly start a funding authority to get on research. I mean, outside tech fund. That is specifically dedicated towards, just like NIH, so that it can improve the research culture and enhance research activities across the country. Thank you very much, sir, for the presentation, sir.
Thank you very much, Bob.
Okay. Thank you, sir.
Hello. From me.
Hello. Okay, I also have a sort of question or comment, sir.
Okay, go ahead.
Okay. I want to join others in commending you for the wonderful and brilliant presentation. My own comment is there a sort of networking or collaboration between medical research institutes and agricultural research institutes, knowing fully well the interaction between nutrition and health? Because if those in the medical sciences are working on health and the citizens are not well fed, we know the impact. We are advised to take drugs as food and food as drugs. Is there a meeting point between medical research institutes and agricultural research institutes, so that what medical research institutes are doing will be well established and more impactful? Thank you very much, sir.
Thank you.
I think Professor Salako, sir.
Yes, please.
Would you rather take all the questions together? So, because there are a few people left. Yes.
I can take one more. Oh, don't let a few people left.
Yes.
Okay. Yeah. Let's hear them then. Then I can take.
Yeah. Obo Samuel, sir.
Okay. Good evening, sir.
Good evening.
Yes, I want to appreciate Prof for the presentation. It was a great one, very educative. My question is, with this talk, how do we collaborate the medical section of the university to statistics, knowing that data is what is driving most of the research? And we discovered that most of the research in our university now, they are just chef-worthy, and true, there is no funding. But what is the impact? How do we promote this collaboration between statistics and the medical college so that we can be able to impact our country? Thank you, sir.
Just a minute, Dr. Eboluwa Akpata, please.
Thank you very much, Professor Salako. I really also appreciate you for that presentation. You mentioned during the course of the presentation that we have North-South collaboration in research, but we don't have South-South collaboration. I want to ask, sir, how do we bring about this? Who will initiate it and when? Who will bear the cat so that others can follow?
Okay.
Zachariah Hussein, please.
Thank you very much. Thank you very much, Prof, for the presentation. Well, I just have a question that has a follow-up comment. Are there any platforms where medical research institutes engage with policymakers to influence policy in Nigeria particularly? And also, if this does exist, are there any success stories with partnership with perhaps state governments, or, well, I expect to have been with federal government, but with state governments or local governments? Thank you, sir.
Okay.
I think that's about all hands that are raised and have not told or asked questions. I would want to request Professor Salako, after he has finished answering, if he doesn't mind, we could ask Professor Aminu and Shueton to make a brief comment with respect to collaboration, not working in silos, which you have already mentioned, because they have some efforts which are geared towards solving this. So after Professor Salako has satisfied the questionnaires, we would request Professor Shueton, Professor Aminu to please say a few words about opportunities for collaboration across disciplines and across locations. Thank you. Professor Salako, sir.
Thank you very much, Prof, for guiding the question period. Let me start by the last one, platform. They are platform for medical research institutes and policymakers. Policymakers are the principals of medical research institutes. So they provide the funding. And usually every year, you also write a report that you send to them. And from time to time, you meet to discuss issues in relation to your institution. But there is no special platform where they will listen to the results of research from your institution. Sometimes when you do conferences and do all of that, you invite them as individuals, they come. But as Ministry of Health, for example, to sit down and say, okay, all our research institutes, you need to come, let's discuss your research output. We need to create that. And the next one was South-South. How does it happen? Who will initiate? It is not that we do not have South-South collaboration, but it's not as strong. We will rather look up to the US, the UK, Canada, and co, than to look up to other African countries. And until we start to do that, we may not be able to quickly solve most of our problems. Because if we do South-South collaboration, you can look at burden of disease. They will probably be the same, maybe with a bit of difference along the coast. The challenges will probably be the same. So if we work together, one solution will solve problems for many nations, compared to if you go to the north and then you find a solution that it's not our own peculiar problem, then it cannot be that useful to us. But in terms of learning and training, maybe it's still good to have North-South collaboration. But in terms of skill acquisition, it is better from South-South collaboration because you can have access to everything that you need. I believe that the African Sciences Group Network Group is already doing this and has created a platform for us to know each other, to meet each other, and to be able to make requests if you are looking for network or collaboration. So we have started well, and the impact of this group and network, I believe in the next few years, will be seen to have improved either our research capacity or even our health system or research system generally, because we would have been able to crisscross amongst ourselves and network amongst ourselves, and we can then do a lot more than we are doing now. Now, medical college and statistics, I really don't understand that question very well, but I know that medical schools have departments of biostatistics as different from pure statistics. And even with pure statistics, there is still opportunity to work together. So working within, I mentioned somewhere, intra-faculty, we must continue to talk to each other, to collaborate with each other within the universities, and of course, within the research institution. These are new ideas we need to imbibe for us to be able to build the new things and overcome those challenges. Medical research and agricultural research institution. I honestly must say that I'm not aware of an active platform, but I know that there is a national science and technology, something that's been established by the country. There's also a particular funding for it, but that has not been very active because my institution is part of NASENI, but we really haven't gotten any funding from NASENI or any overture from NASENI. And yet it is supposed to be taking care of technology and research in Nigeria. So I must say that when I became DG, I went to the Ministry of Science and Technology because somebody told me that NASENI exists and that there is fund there. And what I got was that nobody has actually deployed the fundings and that they are still trying to look at modalities. And up to today, we really haven't had anything. Yet that body exists. Now, the other one is NIMA and infectious diseases and whether we are going to be looking at NCDs. NIMA started as a yellow fever vaccine development and research. And that was why a lot of the things it's been doing is in relation to infectious diseases. But since I came, I've been trying to see how we can veer off to NCDs. You know, I myself am a kidney and hypertension specialist, and my research area really is in that area. But what has happened is that we have not been able to either replace retired staff or even recruit new ones. So we don't have anyone who has been doing NCD research because there are no staff in that area. And we've been trying to expand to that area. So in future, if we get the opportunity to expand, certainly NCD research will continue to be done. For funding agency, we have recently been engaging government. In actual fact, we have gone through the House to pass for establishment of Nigerian Medical Research Council, because NIMA itself at some point started as a medical research council, and medical research council is supposed to be funding and conducting research. So we believe that if the council is signed into law, is currently in the presidency, if it's signed into law, then we will have a specific health research funding agency, which will be funding health research. That will be addition to TED Fund and to National Research Foundation. Now, the issue of NAFDAC and regulating clinical trial, I will rather not make a public comment on that. But I will say that because NAFDAC has to regulate, has to register new molecules to be used in Nigeria, they necessarily must regulate the trial of those drugs. Otherwise, they can say that the results of the trial is not acceptable to them. So this is what has given them the power to regulate. And whether you think they have the capacity or not, it is in their purview to regulate clinical trials. We can then all try to see how we can engage with them to ensure that this is done in a better and faster way. Now, with all the solutions and everything that I've said, Prof said, how do we move forward? And I'm just going to give an example. To move forward means we have to do a lot of what His Excellency Babatunde Fashola called research evangelism. We recently created a NIMA Research Foundation, having found out that the funding from government is nothing to write home about. And yet we need to conduct research. So we created the NIMA Research Foundation and asked him to chair the board of trustees, which he did. And he was the one that coined research, the word research evangelism, that we must do beyond sitting in our office and complaining. We must go out and advocate to the policymaker, decision maker, the private sector. We must talk to everybody. We must let them understand not just 10 people are dying in every second, or the burden of hypertension is killing Nigerians. We must also begin to put to the private sector the business in research and health. The fact that you can put money in research and make money back, that there is a return on investment for research, so that the business world can now look at research as a business, and then they can put money into it. We must let them know beyond people are dying, young people are dying, old people are dying, that research can create employment. When you fund research, there are several employment positions that will come up. You need the data analyst, you need the laboratory support, you need the community engagement consultant, you need all sorts of people. You need cost containing people. All of these are going to be benefiting from the funding of research. And that is providing employment to people. When government realizes that, oh, there's a lot more that they gain by funding research, not just saying the professors just take the money to go to meetings, then we may be able to get them to fund research. And the example I said I was going to give was that Fashola then led us to meeting a number of people. We met the central bank, the SY central bank governor. We met House of Representatives and Senate leadership. We then met the Minister of Finance, and that evangelism led to NIMA getting 1 billion naira for research in 2023 appropriation. So to me, it shows that we can actually make the difference if we go out to talk to them, if we go out to meet them, to let them understand what the country stands to gain in funding health and funding research. This is what I believe should be the way forward. And that's why I mentioned the Agenda 2063, where the African leadership themselves have set that agenda. All we need to do is make advocacy visits, remind them of this agenda, tell them what can come out of it, and how best they can handle it. Again, this should be done on a continuous basis for us to get them to respond to our requests. I believe that I've been able to capture some of the issues that have been raised, and I would like to rest my case here.
Thank you so very much, Professor Salako. As usual, excellent response. But we have a few questions, if you don't mind, from the chat forum. If you just jot them down. Okay. Now, well, the innovations you've made, are the tools patented? Secondly, how much of patronage, you've answered patronage from federal government. Number three, how is NIMA collaborating with marketers to sell all these around Africa? You see how much people love you? And the questionnaire wants to request that NIMA brings on board promising young researchers who may be able to learn from them and be mentored by NIMA. There are other questions. Beg your pardon. Somebody wondered how we might improve the pay of researchers in Nigeria. And Andrew Reyes wants to know what a researcher should do if you write a grant and is rejected without explanation. How do you know where things went wrong? And Sahid Adekola wants to know if NIMA gets grant through WHO and AMR, and if NIMA is part of GLASS on AMR. These are some of the questions, but there are fundamental. Before you take on, and because after this you would speak, and I will request Professor Shueton, one of the organizers, to emphasize how they have been making efforts to bring multiple disciplines on board in Africa. Now, your statement about the need to learn and relearn things is very fundamental, and Nigerians should think of planning or replanning our educational program to answer the questions that are facing us in multiple sections. This may be short term, like you've mentioned about medical schools, and maybe intermediate, like entire curriculum, and maybe long term, like child raising to program to, and beg your pardon, not program, to educate people to be prepared. And somebody was talking about our researches and whether or not they get publicized. I'm aware that in other places, librarians summarize important findings in various journals for the attention both of the academia and society. And I'm aware that in many places, journals have persons that engage the social, various media in their countries, so that important findings appear in the news. But these are not accidental at all, these are designed. I just thought I should mention this. Now, if you don't mind, please quickly respond to those questions that came up through the chat box. And I would request Professor Shueton or someone else among the organizers to emphasize how this forum has been planning to bridge disciplines, break barriers, post-silos way of academia. Professor Salako, sir, thanks a lot.
Thank you very much. Quickly, whether NIMA gets grants, yes, NIMA researchers get grants. We have grants from NIH, from Canadian government, from BDCTP, from several Bill and Melinda Gates. We have ongoing grants. And whether we are part of AMR, very well. We're working with NCDC and the ministry. We are part of the Antimicrobial Resistance Committee. In fact, currently we have a project on safety and antimicrobial resistance of mass administration of azithromycin, which is being touted to help in improving under 5 mortality. That project is still ongoing, so we can't tell what the result will be for now. Now, researchers write grant, gets rejected, no explanation. I'm sure you can write a mail to say you not mind if you can have reports of the reviewer. And I believe that they might oblige you. But having said that, it's like when you are planting a seed, sometimes you plant one, it does not survive. Sometimes you plant one, it survives a little, you thought it's going to grow, it dies on the way. And sometimes you plant it, it comes up. So it takes time for you as a young person to win the grant. It's not immediately, you may be lucky that your first one will come up successfully. But oftentimes, go and ask people who have gone through it before. So you must be used to writing something and they said no. Put it together, repackage it, look for another funder and send to them. It's like wanting to publish your paper too. And you continue to do that until you can record your first success. That will give you experience on how to do it. But beyond that, you want to send in a grant, you must be familiar with the funder's area of interest. You must follow the instructions. Don't do beyond what they want. So apart from science, there are so many other things that determine whether you are going to be funded or not. So getting rejected should not make you sad. Just put it together and continue to search for funders. Whether we have patented or some of those things, yes. We have patented some are currently still being processed. And whether we have marketers, I can tell you that we have sold one of the products for 30 million, very small money, because I just wanted to prove that as a Nigerian institution, we can do experiment, we can develop, we can produce, and we can take to market. And we have been able to do that in one case. In many others, we are currently having a discussion with a company that is trying to help us market some of these products. And we even have people from outside Nigeria who are talking to us on some of them. We are yet to reach any conclusion on what way forward we want to take. But certainly we are trying to do that. What I also miss is to say that research institutions must also create a small communication and marketing company that will engage the marketers outside and the public with these products so that we can push them to the market. It's far away from the so-called Silicon Valley that you have in the US. Hopefully one day we'll be able to create our own. And innovations from universities and research institutes can have a direct market where they can go to. I think that is all that I remember. I want to thank the organizers once again for giving me this opportunity, and to thank Professor Malomo for accepting to chair the discussion. Thank you.
Thanks, great having you. Professor Shueton, any brief word? And you might just thank Professor Salako for also. Professor Aminu Shitu then. Okay, Professor Salako.
Yes,
it's my honor indeed, in the behalf of this entire group and all those who will. Good evening.
Hello, good evening.
Good evening, sir.
Good evening, Professor Malomo, Professor Babatunde Salako. This is Dr. Aminu Shitu from the Faculty of Veterinary Medicine, Usman Danfodiyo University, Sokoto. I would like to thank Professor Babatunde Lawal Salako for an interesting talk. Very, very enlightened. A lot of, he told us things that are unknown, honestly, and that's challenging to all of us, which tells us that we have to sit up, we have to buckle down more. There are a lot of challenges tackling the issues related to health research in the continent, both in the country and in the continent. And so the little thing that I would like to say, first of all, is to one of the members of the AfriScience network team, and also, so I will first of all thank all the team members, 6 of us, for the success of this. And a little bit that I would like to add is I'm opportune to work at the Institute of Infection and Global Health, University of Liverpool in the United Kingdom. And I worked on modeling the spatial distribution of Fasciola hepatica, which is a parasitic disease of liver in ruminants, specifically cattle and sheep farms in Great Britain, where we use climatic and environmental variables in looking at the impact on the distribution of disease in dairy farms in Great Britain. And in that group, Institute of Infection and Global Health is a kind of a group which includes almost, I can say, every specialty in the sense that the name is Institute of Infection and Global Health. And you see entomologists working on the biology of insects, you have epidemiologists, mathematical modelers, you have people whose degrees are mathematics, nothing like biology in their training. It's mathematics, physics, climatology. In fact, right now, we are having an ongoing project where we are modeling the distribution or dispersal of influenza pathogens in poultry farms in Nigeria and Egypt. So we are working with a physicist in the Department of Engineering, University of Copenhagen in Denmark. So we are using stuff like computational fluid dynamics. This is a concept that is known by physicists and engineers. We are looking at how those viral particles are moving, how they are dispersing within the air, taking into consideration parameters like the wind speed, the temperature, the direction where the wind is blowing, etc., and working with probability models, looking at the possible route or pattern of transmission of influenza pathogens in dairy farms. In poultry farms. Poultry markets. And so stuff like this. So in the University of Liverpool Institute of Infection and Global Health, the people come together, almost everybody, including social scientists, because nowadays decision in infection control is something that is all encompassing, not just biologists, not just scientists. We also need psychologists there, sociologists that we work with in order to change the mindset of the community towards the acceptance of our products. Vaccines most especially, and new drugs. So we also work with the traditional rulers. So you have everybody. So the infection control is actually something that is multidimensional, as Professor Babatunde, Lawal, Salako rightly pointed out. And so everybody needs to get involved in it, including religious leaders. And that is one of the aim of the AfriScience network. Honestly, we are trying to bring in researchers and scientists within the continent and abroad to come together, irrespective of their field, whether you are from the biological background, biology, microbiology, medicine background, physics, geography. We work with them, we need them. We work with social science, although there is less involvement of social scientists in the network. Majority of us are scientists. There are a lot of statisticians in platform number C and number D, a lot of data scientists there, and platform number E is growing now. I think we have over 100 or almost towards 200 new members now, and majority of them are medical doctors. So we're working towards achieving all this, but for now we have some challenges. I must honestly, these are some of our limitations, or let me say hurdles that we are trying to cross. First of all, we are trying to get registered, and so that we can have that confidence. And also we are trying to create a website and also to look for sponsors, because finances, honestly, these are the big issues. And also the issue of, there is also a plan to, although this should not be immediately or within a near future, but we believe that it is feasible, looking at the diversity of the AfriScience network. We are interested in creating a journal also. Well, the proposed name should be something like Evidence. So we'll just call that journal Evidence. And then we say Journal of the AfriScience Network. So there are all these things we need to put heads together. And I'm going to discuss it with the members of the admin, and then we will share it on the group. Or I don't know, honestly, this is my thinking, but we started talking about that with the admin, and by the grace of God, I will push it up, and then we will communicate our whatever we agreed upon with the members on the general platform. Once again, thank you very much, Professor Malomo and Professor.
Thank you very much
for the wonderful presentation. Thank you very much, sir. Thank you.
Thank you. Thanks, sir.
Thank you.
I think with that, thanking Professor Salako once again for an awesome session. We will regard Professor Aminu as having brought this meeting to a close. Professor Salako, thank you very much. Greetings to Haji and Co. God bless.
Thank you very much, sir. Bye, sir.
Thank you very much, sir. Enjoy your evening, everyone.
Thank you very much.
Thank you, sir.
Thank you very much, sir.
Thank you very much, sir.